Hello, this is Henry. It's Monday, and the new topic for this week, the topic for this week, is body image. Body image can be a huge issue for trans people, and I think most people are not entirely happy with their bodies, but I don't know. Some people kind of just, this is how it is. Nothing you can do about it, and I am one of those people. I am pregnant. My figure is not very male right now, at least. My chest is growing quite a lot. Has grown quite a lot, and that would be a huge issue for some people, but I kind of just go with it because, after all, I always wanted a kid, and why not do it for one kid? Body image. My body image has always been quite good. Like, I am confident in many ways of what my body looks. I'm very short. I'm like 5'2", and that would probably be my main issue. I would like to be a little bit taller. Like, to not be the shortest most times, I guess. That would be nice, but it's not necessary. I do fine in my little, tiny little body. I have wide hips, and my hips are, I don't know, they're okay, but of course they're a bit wider now than they were before. But it's, maybe it'll stay after tea, maybe it'll go down a little bit, maybe, I don't know. I just try not to think about it too much, but it doesn't really bother me that much. My shoulders and back are probably what I would think of as my strongest feature, because I have quite broad shoulders and my back is fine. Like, you wouldn't look at me from behind and be like, oh yeah, that's a girl, right? Unless you saw my hips. But that's like, I have things, my body has things that I can be happy with, and my body has things that I could see myself having better, I don't really have much dysphoria. I just kind of roll with how things are going, and I know I'm going to get hormones at one point, and I know I'm going to get top surgery and all of that, and I just kind of patiently wait for it. I'm not really counting down days. I just wait for it, because the transitioning system in Iceland is a bit messy, and you kind of have to wait a whole lot. Like, if they're going to tell you, yeah, you'll get hormones in like a month, you should probably think about it as 2 months, because they might postpone it and kind of put you on hold, or you can't get this appointment, or whatever. It's all a bit weird, and you can't really rely on dates much here. So yeah, I've just decided to be patient and not worry too much about it. And you know, the whole having a baby thing, it backtracks me a little bit. But that's fine. I mean, I am doing this for the sake of having a kid, because adoption process in Iceland is horrible and takes years. And I would rather have a baby of my own right now than put in an adoption, apply for adoption in like 5 years and not get it until I'm 40. That's a case that has been recently. Like, someone applied for adoption and didn't get qualified or whatever until like late. Plus, if you're going to be adopting, you have to be married, and you have to. I think that's how it is, at least. You have to be married, and you have to kind of, have your whole life laid out. Like, you have to have a solid job and be able to show them that you are capable of, having a kid and are financially okay. Which I guess we could say we're financially okay, but we're not doing great. So that would be. Oh, I'm getting way off topic now, but yeah, I don't mind having a kid, and it doesn't ruin my body image a little. It does ruin my body image a little bit, but I don't mind. I'm gonna be a father to a kid, so that's all that matters, I think. If there's anything I'm worried about in this pregnancy, it's stretch marks on my belly, that is. Because that's, I don't know. Some people say you can avoid them, and I guess I'm not doing the best I could be doing to avoid them. But some people say you can't avoid them, that they're genetic and they come from the inside, and you can't really soften up the tissue around enough. So whatever. I'm just gonna smother myself in vitamin E after, or when I get them. When or if I get them. I mean, I'm pretty far along now and I don't have a single one. Not on my belly, but yeah. Also about stretch marks. I have stretch marks on my thighs, and some people are really self-conscious about cellulite skin and stretch marks. And honestly, I don't really show my thighs and my legs, my butt, to people, so I don't really care. And that's where all of the things are. I don't have cellulite on my shoulders or something where people see it. Just on my thighs and on my butt. Maybe a little bit down to my legs. But that's it. So it's fine. Anyway, this is getting longer than my videos usually are. So yeah, I'm gonna go now. Bye!